The name of this presentation is what I call Seeing and Embracing What's Behind the Surface. A lot of time your patients, when they come in, they're going through a lot of things, and we're going to talk about that. We're going to talk about what is behind the surface. And so before I get started, I do want to give you guys a shout out, because I do believe that you guys work the hardest. You guys balance the most. You have to balance machines beeping. You have to balance putting patients on, putting patients off, and you have your boss and supervisors and charge nurses, everyone, even Medicare and insurance coordinators, always glaring at you, making sure you're doing your job right. And so kudos to you for doing what you do. There's no way in the world I can manage the time, manage all the patients. You guys do an amazing job. And so I want to say thank you for keeping me alive. You guys do an amazing job. If it wasn't for you guys, I wouldn't be around. I've had over 8,000 hours of dialysis, and I wouldn't be around if it wasn't for you guys. So thank you for having me. And I just want to just give you guys a shout out. So let's get started. So this is a picture of me when I first lost my kidneys in 2009. In 2009, I was probably 4'10", 420. That was the year, these pictures were the year I lost my kidneys. Now, dialysis was tough that year. So once I finally got on dialysis, I did it in the hospital, right? I did dialysis in the hospital, and dialysis at the hospital was great. It was super easy. The nurse brought the machine inside of the room. It was just me and my wife and the nurse, and she explained everything that was going on. She kept me comfortable. I was in my bed. I was next to my wife. It was an amazing experience. I'm like, this is going to be super easy being on dialysis. But that doesn't last very long. Then you go to the center, the in-center. I went to Fresenius in Plano, right? And so I go to Fresenius in Plano Tuesday at like 3:30 something, and I go there, and they open up the door, and there is 50 people in this room. There's 50, there's 4 bays, there's 5 on each row. There was easy 50, 60 people in that row. I sit down, I'm next to people, there's people in wheelchairs. It was just a crazy scene. And I wore the wrong shirt. Okay, so I wore a regular t-shirt, and I had a chest catheter. And the chest catheter is, you know what a chest catheter is. And so I didn't have the right shirt on, so what the nurse did was she couldn't get to it, and she was in a hurry, so she grabbed some scissors and cut my shirt down and exposed half of my chest, half of my big old man boobie, and I was 400 pounds, that's a big old man boobie. It was all out, and I had to sit there for 4 hours to 30 minutes with all my stuff hanging out. It was a very humiliating experience. Very humiliating experience. And so I told that story to say dialysis is a traumatic thing to patients. And it fits the definition for chronic trauma. Chronic trauma means something bad that happens over and over and over again. I go to dialysis, y'all know, 3 times a week for 4 hours, 30 minutes. Every single time I sit in that chair, it reminds me of that first experience. And so dialysis is a traumatic experience. So because of that, it shows up in different kinds of behavior. It shows up in different kinds of behavior. So it shows up in 5 ways. 5-way trauma shows up. So we're going to go over all 5, but I want to explain to you that trauma shows up, and it comes out in behavior, and it comes out in multiple ways. So I'm going to show you all of them. So the first one is emotional numbness. This is me 100%. When things are going crazy in my life, I usually shut down. And so every time I go to the clinic, every time I go to the facility, I just want to get in, get out, and get it over with. I don't really want to talk to nobody, just let me sit down, put my blanket on, put my headphones on, watch movies on Netflix, or do homework or schoolwork, or whatever I got to do that day. I just want to be left alone, don't talk to me. The social worker wants to come talk to me, I don't really want to hear it. And so that's kind of how I was especially the second time I got on dialysis. The second time I got on dialysis, it was even worse. I was completely shut down, because I didn't want to be there. I had a transplant that failed. I'm miserable that I'm back. And so, yeah, I didn't want to have anything to do with anybody. So the first one, that was me, emotional numbness. The second one is hopelessness. This was me in 2011. I started what I call acting sick. I started going out playing with the kids because I'm like, I got to conserve my energy. I start like, okay, this is my life. This is my life now. There's no hope. I started getting miserable, depression sets in. And so maybe we wonder why our patients are hopeless. Maybe we wonder why they're lethargic. I'm sorry, tried to say it'd be a college word. We wonder why they're unresponsive. We wonder why they're depressed because of traumatic things that happened to them because of dialysis. The other one is the terrible one, which is skipping or shortening treatments. Of course, I don't want to go to dialysis. Some days I'm driving after I've had a long day at work and my chair time is 5 o'clock. I've worked a long day. I had to get up super early. I'm tired. I just want to go home and be with my wife. My wife is doing something fun and I really don't want to be there. I really don't want to be there. And so it's hard sometimes to show up. It's hard sometimes to know you got to do this. Now, certain patients say that skipping treatments or shortening them, they feel better, especially if they skip it all together. I'm a part of a lot of Facebook groups and that's what they say. And the reason why that is because they don't show up to get traumatized. And so anytime you don't show up to get like emotionally beat down, yeah, you feel better. You feel absolutely better. So that's why some of the patients are saying, I feel better when I don't show up. Yeah, don't get me wrong. Dialysis makes you, I do get tired afterwards. I do feel a little bit, don't have as much energy as I did after I left. And so sometimes that draining you don't show up for, you do feel bad. So it shows up in them skipping and shortening treatments. Also, it shows up in fear and anger. That's why that patient is irritable. That's why that patient doesn't really want to have anything to say to you. Maybe that's why that patient is rude because there's traumatic behavior showing up. And the last one is distrust. You just try to make money off of me. Even though we understand that insurance pays for a lot of this stuff, Fresenius is a multi-billion-dollar company. A lot of patients know that, and so they're like, they just want me here to make money. I don't trust anything you guys want me to say. You want me to come for extra treatment? You're just trying to get money out of me. And so that's how that behavior shows up. It shows up in all these different ways. And so now it's time for you to see, I want you guys to rank these. So just guess. You guys have been around patients for a while. You guys know what's going on. And so just guess. Which one do you think shows up the most? So it looks like we got a tie. So emotional numbness and hopelessness. And so the last clinic I did, skipping and shortening treatments was number 1 and emotional numbness was number 2. And so I'm doing this because I want you guys to be cognizant and be aware of what behavior that you're getting. Because it's going to show up in different patients, but emotional numbness is kind of how I did it. But normally every time I go is either skipping or hopelessness is what they see. So it's good to pay attention to that. All right, so let me ask you, what if the patient who frustrates you the most, the patient that frustrates you the most is the one that needs you the most? They're frustrated because they're emotionally numb. They're frustrated because they don't trust you. They're frustrated because they feel hopeless. They're frustrated because they don't even want to be there. That's why that frustration comes. So what if the patient that like gets on your nerves the most is just crying out to you saying, I really need you to slow down and have an honest conversation with me? So that's why we're having this conversation. That's why I'm here today. So let's keep going. Let me tell you a quick story. So, like beginning of this story, I said I was big, and I think at my biggest I was 400 pounds. But anyway, after the transplant in 2017, I gained 50 pounds because I was celebrating. I got a kidney transplant. I don't have to watch my diet anymore. There's no more BMI restrictions anymore. So I kind of celebrated. And plus I got a job at a call center, which means I was sitting down every day, and there was a McDonald's and Lucy's Chicken right across the street. I could get 2 pieces for 50 cents. So man, I was wearing them out. so anyway, so I gained 50 pounds like that. And so my nephrologist said I would see at least once a month because of, kidney transplant. You got to keep going in and doing labs. And so I was seeing her once a month. And so he said, man, your weight is getting higher and higher and higher. And so one day I came in and he made me wait in the office by myself for like 15 minutes to feel like. He came in and says, man, I am sick and tired of your weight. You're going to blow it. You're going to lose this kidney. Let's take weight off the table. So I've already scheduled a surgery for you to go see the weight loss surgeon and to go and get to sleep. And so here's the stuff. Go see him right now. My nephrologist didn't mess around. He talked to me kind of crazy, which is I needed it. So anyway, so I go down to see the nephrologist. I go down to see the kidney surgeon, the weight loss surgeon, and we did the surgery. I go up there and everything's good. After the weight loss surgery, they run a test. I have to drink this fluid. I guess that glows in some kind of like machine, and I'm drinking the fluid, and they're watching. They're supposed to watch it go all the way down through my esophagus to make sure there's no leaks. Well, when I drunk it, the dude said, "Uh-oh," and I looked over, and it was going this way. Stuff is going this way. I'm like, it's not supposed to go this way. It's supposed to go all down. And he said, "Oh, we got a leak." And so they immediately stopped. They went back up to my room. I was in the OR the next day. They put a metal stent down my throat, thinking that that would fix it. But to me, that made everything worse. I had the most severe heartburn that I've ever had in my whole life. I couldn't even drink water. Water burned going down, and I would throw it up. Any food that I ate, I would throw it up. I would just throw it up so much. I didn't know anything. I didn't have any other fluid to throw up. I just kept throwing up. I couldn't sleep. I couldn't eat. I was always spitting up. It was miserable. So finally, after 2 weeks, I lost 50 pounds in 2 weeks. I called my primary care doctor, and I'm like, man, I told him what was going on, and he got upset because we're friends. And he said, you should call me sooner because that guy is dragging his feet because he messed up that surgery. Because he messed up the surgery, now he's got to pay for it on his own. Medicare and your insurance is not going to cover it. He got to cover that out of his pocket because he messed up. So that's why you're waiting so long. So call him right now and repeat back everything I said. So I told him what I said, what the doctor told me. I was in the OR the next day. They pulled the stent out, they fixed it. I was good after that. But my kidney numbers got affected because I wasn't eating, I wasn't drinking, I wasn't going to the bathroom because I stopped eating, and the medicine wasn't taken like it was supposed to. My kidney numbers got severely impacted. So the nephrologist came and visited me at the hospital. The same guy that sent me to get the surgery. So he comes in, real quiet, walks over to me, puts his hand on my hand, and says, "Brent, I'm sorry this happened to you. I'm sorry that happened to you." Man, when he said that, me and my wife, we started crying. I got upset because it just felt like his words kind of made me feel better. Like the weight of all the stuff that I was going on and the surgeries and the losing the weight and throwing up and all that stuff, him saying I'm sorry just made a difference. Like it kind of restored my trust back in the medical field because I was second guessing myself for having the surgery anyway. I'm like, why did I put myself through all of this? And so him saying I'm sorry, he stood in the gap for every medical professional that's done me dirty, every medical professional that has done me wrong, every medical professional that messed up. He didn't even mess up the surgery, but him saying I'm sorry made up for it. I talked to the guy afterwards. He never really said I'm sorry. He says, well, sometimes, he just kind of brushed it off. But I was good because that guy said I'm sorry. And so I wanted to say that because, listen, sometimes you guys' words can really help out patients. Sometimes you guys' words can really have an impact. That guy saying I'm sorry fixed everything, and yeah, fine, I look great now. But him saying I'm sorry made me feel like a person, made me feel whole. I felt valued and I felt respected. And so you guys' words mean a lot. You guys' words mean a lot. So let's keep going. So imagine what could happen if every patient interaction became a moment of healing instead of just another task. What can happen if every reaction that you had, patient walks away better? What if every reaction you had turns out like that I'm sorry story? Like the weight of the world is lifted off and you restore that person's hope in the medical profession again. So you guys' words have a lot of meaning. How you deal with patients really matter a lot. So now I know we've been dealing with emotions and things like this. And let's go to evidence. Let's get nerdy again, all right? Let's get nerdy. So let's look at the brain, right? So I'm going to keep this real simple, right? Because I know you guys know this stuff, but I want to keep it kind of real simple, right? There's two sides of the brain we're going to talk about. The upstairs part and the lower part. Let's talk about the upstairs part. That's where the friendly hormone is. They call it the love hormone. That's where social interaction is. That's like going to your mom's house and she cooks your favorite dish. That's like going over your family's house for Thanksgiving and everybody's smiling, everybody having a good time. This is the social interaction. This is safety. This is where trust is. This is where connections with family is. This is where like you feel safe in an environment. This is like your favorite coffee house or your favorite restaurant. You feel safe, you feel warm, you feel welcomed. That's what the upper brain is, right? So when that guy told me I'm sorry, it hit the upper brain. It calmed me down. It made me feel safe. It made me feel respected. It made me feel important after he said I'm sorry. But there's another part of the brain, the lower part of the brain. Now, this is a great part of the brain. Now, don't get me wrong. This is where we get the fight or flight part in our brain. So if I'm walking down the street and a dog jumps out at me and and it bits me in the leg and I got stitches and stuff like that, the next time I walk down the street, this part is going to get activated because I'm going to remember that dog bodied me and I'm going to tense up because my body's trying to protect me. Well, this is what happens. This is the part that's activated where patients are not trusting you and they're traumatized. They stay in this part of the brain. If you're in this part of the brain, you're tensed up. Your oxygen levels are high. Your heart rate is high. The cortisol is high. You're stressed out. Your blood flow is not great. You're tensed up. You don't trust anybody. Your defenses are up. Your walls are up here. This is when you're upset and you have an attitude and you don't feel safe. And a lot of patients, because of dialysis, stay here. And so you wonder why they're not being very friendly. You wonder why they're being they're being rude and disruptive. You wonder why they're having an attitude. You wonder why they're snapping at you and never smiling, because they're trying to protect themselves because it hurts too much. And that comes from this side of the brain here. So when that doctor said, I'm sorry, it went to the friendly part of the brain. But when that nurse cut my shirt, it went to this part of the brain. Now I'm defensive, I'm scared, I don't want to be there anymore. And so it's important to understand that this is not just being soft, this is science. This is science, so that when you have interactions with patients, when you have interactions with people, it goes to the brain either in a friendly area or a fearful area. Let's keep going. Let's walk through this real quick. So even before dialysis, your patients, even everybody in this room has some kind of trauma. There's this thing called the ACEs study where it talks about past trauma. And there's this score you can get. Everybody pretty much scores high in these things because all of us had traumatic childhood, right? All of us were bullied. All of us were made fun of. All of us have issues. And so even before this, your patients walk in, this is the heart, holding a lot of traumatic things, even before dialysis. But then you add bad news of dialysis. You add stress. You add past trauma. And they're walking into the clinic with all of this stuff holding it. It's hard to hold all of that stuff, right? And this is how a lot of our patients are walking around, holding past trauma, holding stress, holding bad news, holding the weight of dialysis, the lifestyle change, all of that stuff. They're walking around holding this stuff. And then a minor inconvenience comes out. This could be for patients, okay, your chair time is 5 o'clock. Y'all don't put me on until 4:45, or I'm supposed to get off at 9 o'clock. It's 9:45 when I leave. Or when I get there, y'all put me in a corner and the TV don't work. Or the needle sticks don't work and the machine is beeping the whole time. And you have to pull the needle out and start all over again. It's a terrible thing, right? And so you're dealing with past trauma, you're dealing with stress, you're dealing with dialysis, and a minor inconvenience happens, and then crash out happens. Sometimes people think we're overreacting. It's only because we're holding all of this other stuff. And then so when something small happens to the outside world, it's because we're holding all of this stuff. And so that's why when your patients come in, they're irritated or they're frustrated or they're short with you or they never say anything nice. It's because they're tired, they're crashing out because they're holding all this stuff. And so I'm sharing all this again, not for you guys to be like, oh my God, we got to be super sensitive around the patients, just so you can be aware of what we're going through and change the way you respond to things. So let's do that right now. Let's practice. And so with your phones again, tell me why this is wrong, because this is wrong. This statement here is wrong. because I've said this, I'm scared, I don't want to do this today. That tech told me you'll get used to it. She said this with a straight face. Now, of course, you do get used to it, but why would you say that to somebody that's scared? You're right, it seems insensitive. So it seems insensitive and it seems dismissive. You're absolutely right. You're absolutely right. When somebody's scared on a machine, when somebody doesn't want to be there, yes, they'll get used to it, but it's super insensitive. So what is the correct response? Let's go to the next slide. Somebody says, I'm scared, sounds like this is hard for you. Now what that does is, you don't have to write here, but what that does is it makes that person say, you know what, this is hard. Because that person knows, we know that that tech and that nurse can't fix my kidneys. We know that. We just want you to acknowledge that this is hard for me. Just acknowledge it. Sounds like it's hard for you. And watch, that person's shoulders will drop. Yeah, you're right. It is hard. This is tough. Sometimes all people just need is for you to agree with them. Sometimes all they want to know is that you're on their side. And then after that, you can say, sounds like this is hard for you. Unfortunately, it does get a little easier. But what you did first is you said, look, I hear you. I hear that this is hard. Then you can speak to the situation. Because you guys are educated and you see a lot. You guys do have a lot of knowledge. But it's better if you acknowledge what the person feels first and then give out the wisdom and knowledge that you guys have. Let's do one more. Let's do one more. Afraid of cramps? Watch your fluid. I used to have this nurse every single time I was high on my fluid. Watch your fluid, Mr. Butler. You know that's damaging your heart and it's irreversible damage every single time. And I know this, but I'm thirsty. I don't know what else to do. That's why I have a little drink here. Y'all don't judge me. But like it's hard for me to limit my fluid because I'm always thirsty. And so what is the correct, this is wrong. So let's talk about what is the correct way to say it. The correct way to say it is fluid control can be really tough. I'll be like, yes, it's the hardest thing I've ever had to do in my whole life. I can handle everything else on dialysis, but fluid control is the toughest thing. And so if somebody says that first, hey, Brent, I understand fluid control is tough. I couldn't imagine what you guys have to go through. I drink like a fish. But there are some things to help you. I might listen then. I'll probably say, well, what are they? Well, what are they? You've been doing this for a while. How has certain patients have success and certain not? And some patients can and some patients can't. So then I'll be more willing to listen because you've acknowledged me as a person. And so let's do this. Let's go back to the brain picture real quick. So when you have the correct response of, okay, fluid, man, fluid is hard for me, and you say, sounds like fluid is tough, that goes here in the brain. Versus, you need to watch your fluid, you're gonna mess up your heart. That goes here. Now I wanna defend it. But you don't know what it's like to do what I do, so I'm gonna defend it. I'm not gonna hear what you say, I'm not gonna listen, I'm just gonna get super defensive. So even the other thing, this dialysis is tough, I'm scared. You'll get used to it, that goes here. Now I wanna defend myself, like you don't know what I'm going through, how am I gonna get used to it? Versus, this sounds like it's tough, this goes here, because now I feel like I got a friend. See what I'm saying? So that's why it's important to watch your reactions and have a trauma-informed language. And so when you guys leave, I'm gonna give you a handout to give you more handouts, say this, not that. And I'm gonna give you 7 tips to change what you say. And it's just little phrases like sounds like, it feels like, it looks like, there's little phrases you can put in front of things and make things easier. So let me close with this story. So, and this is not my story. I got this from Les Brown. Les Brown is a famous motivational speaker. Look him up, he's dope. So anyway, Les Brown tells a story about when he worked in the city about Chicken Man. And so every day him and his friends for lunch, they would go out in the city and they would look for the chicken man because they wanted to make fun of him. When they were having a hard day at work, they would look for the chicken man because this guy would legit walk around the city with an old car, a chicken as a hood ornament, a chicken on his head, chicken in the baby stroller, and every single time they saw him, they'd say, "Hey, chicken man." He'd say, "Bah, bah, bah." He'd talk like a chicken. And so, of course, if you're bored in the office, that's great entertainment, right? And so every day they will look for this guy every single day and look for the chicken man because he walk around like this. They thought the guy was crazy. And so a couple months went by. He was with a coworker and they were going through some old city records. And then one of the coworkers, the clerk, says, "Hey, you guys talk about the chicken man all the time. Here's the story about what happened." So they opened it up and they read it. Turns out the chicken man had a family. He had 2 girls and a wife. And one night, they were all asleep and the house caught on fire. The chicken man wakes up, runs out of the house, tries to grab the kids, but he couldn't because the blaze was too high. He tries to run back in the house, but the house was just engulfed in flames. It was hard to get into. He would have perished. He couldn't force himself to get in that fire because it was all over the place. He basically heard his 2 daughters and the wife burn to death. The brother-in-law comes. His brother-in-law shows up, runs, grabs that guy, throws him on the ground, punches him in the face, and keeps calling, "You chicken, you chicken, you chicken." Kept calling him chicken. "How come you didn't go in and save my wife, save my sister, you chicken? You burnt up my nieces, you chicken." And so ever since then, this guy has been walking around like this for years, like this. He took on the persona of a chicken because at that moment, that word chicken man burned in his brain, and that's what he turned into. And so I tell that story because we don't know what our patients are going through. We don't know what people's background is. We don't know what people are dealing with, but stuff like that happens to people all the time, and we wonder why they're behaving this way. We can't necessarily change their behavior. Now, you don't have to put up with disrespect, but I'm telling you guys this because I just want you to be mindful. Be mindful of the patients. Be mindful of the behaviors that you see because behavior always comes from a place. Behavior just doesn't get created because the person just wants to be weird that day. Most of our behaviors are because of something that happened to us. So just keep that in mind, all right? So listen, I'm gonna pass out these handouts to you guys. If you have any questions, we'll do some questions. We'll go over these handouts, but thanks for having me. Appreciate it.